So hello everyone, so let me just check, am I audible, is the screen clear, so that we can start the session. This is the upper limb session 3rd which we are just going to start. Okay, so yes, so let me just have a look, am I audible, is the screen clear, and we can start the session. Okay. So already covered up the first and the second part. This is the third session. This is the third part of the upper limb series. Okay, yes, I am audible and everything is fine. I was just checking for it and everything is fine. We can start the session. So yes, my dear aspirants, this is for the NEET PG examination. So this series has been started. Myself, Dr. Monalisa, MD Anatomy from Forces Medical College Pune, and I am here to discuss the MCQs related to this topic. Special class features when I am talking, it's an interactive session where the learners and educators interact. Polls are conducted, students can participate in the polls and talk to the educator, get their doubt clear, write itself when the session is going on. Never ever miss a session, and once the session is finished, you can also download the PDF notes. Anytime, anywhere, read from the top educators of Unacademy platform. Plus subscription ki baat kare, when we are talking about the plus subscription, all 19 subjects are completed in a very systematic way. You can study from India's top educator, you can compete in live tests and quizzes, you can have an access to your own device, and you can also have an access to 25,000 and more MCQs made by the top educators of Unacademy platform. Iconic subscription ki baat kare to it's a merging of Unacademy and Prep Ladder. All the benefits of the Unacademy Plus course, well structured, live courses, recorded version, full syllabus, QBank, with 25,000 and more MCQs, competitive live test and quizzes. Along with it, you get the benefit of the Prep Ladder, clinical integrated essentials, QBank 3 with active guidance, rapid revision, snapshots, treasure dream notes of 2021. Congratulations to the toppers of FMGE December session 2021. I wish them best of luck so that they can target their examination with a very good rank upcoming sessions. Also, the batches which is coming up is FMGE 22 high yield revision batches, NEET PG 22 high yield MCQ marathon batch, and this is the details of NEET PG subscription which I am just enlarging to show you the whole details. So this is the detail of plus subscription, iconic, and the light subscription. So for any of this subscription which you are going to take, you can use my code and get a 10% discount. Use the code and add 10 and avail an opportunity of 10% discount. This will be highly beneficial for you. So yes, my dear aspirants, let's start with the MCQ session. Let's start with the first MCQ. So all the best to everyone. Boundaries of quadrangular space is by all of the following except. So boundaries of quadrangular space is done by all of the following structure. All of the following structure is taking part in boundaries, in forming the boundaries of quadrangular space except, which is not taking part in formation of boundaries. So your time starts now. Please mark the correct answer. We have got 4 options and you have to pick the right one. You have to pick the right option. Your time starts now. Question number 1. So yes, Gaurav KD is telling the okay D. Okay. So yes, Gaurav has given his answer. What about others? So yes, Gaurav has given absolutely right answer. Yes, Gaurav has given absolutely right answer. Deltoid is the right answer. It is not taking part in formation of any kind of boundary of quadrangular space. So yes, Gaurav, you are absolutely right. Let me show you this. So let me just enlarge this image so that you can have a better idea of the spaces. Okay. So yes, you can see this, and now my dear aspirants, what I want you to show, so you can see this is the space which you are seeing. This is a quadrangular space. Okay, it is bounded superiorly by, as you can see here, superior boundary is teres minor muscle. Okay, and inferiorly it is bounded by teres major muscle. So inferiorly boundary is by teres major muscle, as you can see here. Okay. Now, if I talk about its medial border, it is by the triceps long head. Okay, and laterally it is bounded by, here lies, laterally will be the surgical neck of humerus. So here we have got all these boundaries, and you can see here above there is TM minor. Okay, below we have got the T major. Okay, and we have got long head of triceps as the boundary, and here we have got the surgical neck of humerus. We have got the surgical neck of humerus. So yes, this is the whole boundary of the quadrangular space. As you can see here, this is the whole boundary of quadrangular space and the structures traversing. So through quadrangular space, we have got two structures traversing. One is the posterior circumflex humeral artery and the other structure is axillary nerve. Okay. So anterior and posterior circumflex humeral artery wind around this surgical neck and form an anastomotic network. Along with it, axillary nerve is also related here. If I talk about the triangular space, that is upper triangular, and we have got lower triangular space. So here this is the upper triangular space, this is the upper triangular space, and this is the lower triangular space. So upper triangular space is again bounded by teres minor above, teres major below, and laterally by long head of triceps, and the structures traversing, just one artery is traversing, and the artery is circumflex scapular artery. The artery is circumflex scapular artery which is traversing from upper triangular space. Lower triangular space, we have got two structures winding, one is the nerve and the other is the artery. So one artery and one nerve. So here the nerve is radial nerve and the artery is profunda brachii artery, PBA, profunda brachii artery. So done with this everyone, have you got the boundaries of all the three triangular spaces and the structures traversing. Let's move on to the next, that is question number 2. Clavipectoral fascia splits to enclose subclavius and pectoralis minor muscle. Clavipectoral fascia splits to enclose subclavius and pectoralis minor muscle and continues down as forming which of the following structure? What does it forms lower down? It is forming axillary sheath, it forms costocoracoid ligament, costoclavicular ligament or suspensory ligament. Which is the right answer? Good evening Chitranjan. Please mark the correct answer. Question number 2, your time starts now. So yes, your time starts now. Mark the correct answer, my dear aspirants. Clavipectoral fascia. Chitranjan is telling it's D. So I got an answer from Chitranjan, he is telling it's D, and suspensory ligament is absolutely correct answer. Yes, my dear aspirant, it merges lower down with axillary sheath, but lower down it is forming which structure is the suspensory ligament. Lower down the clavipectoral fascia, which is forming a covering for two muscles, subclavius and pectoralis minor, lower down forms the suspensory ligament. So you can just appreciate this clavipectoral fascia is this structure, and you can see here it is lower down enclosing subclavius muscle below the clavicle. Just below it also encloses the other muscle. So it is enclosing two muscle. One is the subclavius muscle, other is the pectoralis minor muscle, and it is lower down forming suspensory ligament of axilla. Okay. So also please note down the structures piercing clavipectoral fascia. We have got 4 structure: thoracoacromial artery, cephalic vein, lateral pectoral nerve and lymphatics towards the apical region. So these are the 4 structures which is piercing the clavipectoral fascia, Got it? Let's move on to the next. Question number 3. Capitate bone articulates with all except. Capitate bone articulates with all except. Capitate bone articulates with all except second metacarpal, lunate, trapezium, scaphoid. Capitate bone articulates with all of the following structure except. Question number 3, mark the correct answer. All of you please mark the correct answer for question number 3. Capitate bone articulates with all except, Okay. So anyone? So the correct answer is it is not articulating with trapezium. So trapezium is the right answer. I would like to show you an image and you can appreciate that. So capitate bone is articulating with the second metacarpal. It also articulates with the lunate bone and also with the scaphoid, but it is not articulating with that of trapezium. Let me show you this image. So here I am just enlarging this image so that you can get a better idea. Okay. So here you can appreciate again, this is the this is the radius bone, this is the ulnar bone. So that means this is lateral side and this is the medial side. Now, here this is the scaphoid bone. See, looks too pretty, try to catch her, and this is the lunate bone. So, we have to know the articulation of the capitate bone. Okay, so here we can write C for capitate bone, S for scaphoid, L for lunate, H for hamate, and T for trapezoid. Now, here you can see, if we talk about capitate bone, it is forming an articulation with the surrounding bones. So, it is also forming an articulation with the other bones in the surrounding, that is it also forms articulation with the second, third metacarpals, trapezoid, scaphoid, lunate, and that of hamate. So, all these bones are forming an articulation. So, as you can see here, it is forming articulation with the second metacarpal, the third metacarpal, the trapezoid bone, the scaphoid, the hamate, and the lunate, but not with the trapezium. Actually, trapezium, if we see, the trapezium bone is the right answer. Trapezium is separated from the capitate bone by the presence of trapezoid. So, trapezium is not forming any kind of articulation with the capitate bone. This is quite clear here. So, yes, definitely this will be the right answer. Trapezium is not forming any articulation for the capitate bone. Let us move on to the next, that is question number 4. All the best. Question number 4, your time starts now. Okay, question number 4. So, we have done with this MCQ. Now, let us move on to question number 4. Which of the following muscle does not contribute to the formation of dorsal digital expansion? Dorsal digital expansion. Which of the following structure is not contributing to the formation of dorsal digital expansion? Okay, so please mark the correct answer. So, yes, this is the question number 4th. Question number 4th. Which of the following muscle does not contribute to dorsal digital expansion? Dorsal digital expansion. Okay. So, yes, your time starts now. The correct answer is, so anyone wants to give the answer? Okay, I got an answer. Gaurav, namaste. Yes. So, what would be your right answer for question number 4th? Anyone who wants to give the answer, whether it is introsi, lumbricals, or that of extensor digitorum, which is not contributing to. So, what is dorsal digital expansion? It is the extensor tendon where forming a interconnection between the extensor flexor group of the muscle. It is a insertion of extensor digitorum muscle. So, actually the correct answer is adductor pollicis muscle, which is not contributing. So, here you can see this is dorsal digital expansion has been shown here. You can see here, this is the dorsal digital expansion, which is forming a hood on the dorsal aspect of the phalanx, and what you can see here, there lies the tendon of extensor digitorum. Here lies the tendon of extensor digitorum, and in this extensor expansion, the structure which is contributing is tendon of lumbricals muscle, also the introsei muscle, and so introsei muscle and extensor tendon, no doubt it will be there, extensor digitorum tendon. So, clearly here tendons of lumbricals, introsei and extensor digitorum is forming contribution, and extensor expansion is not contributed by adductor pollicis muscle. Now, let us move on to question number 6. False statement regarding adductor pollicis muscle. Which of the following is a not correct statement about adductor pollicis muscle? Has two heads of origin supplied by median nerve, causes adduction of thumb, opposition of the thumb is also one of its action. So, which is the best answer? Which is the best answer? Question number 6. So, yes, your time starts now. Please mark the correct answer for question number 6. Untrue statement or false statement. Priyansi supplied by median nerve. So, I got an answer for Priyansi and it's B according to her. So, the correct statement here is supplied by median nerve is absolutely correct, dear Priyansi. Yes, we know that adductor pollicis muscle is supplied by ulnar nerve. Actually, ulnar nerve ends by supplying adductor pollicis muscle. This is the reason Adductor pollicis muscle is also considered to be the graveyard of unlearned nerve. It is also considered to be the graveyard of unlearned nerve. Yes, it is also considered to be the graveyard of ulnar nerve. So, this is the untrue statement about adductor pollicis supplied by median nerve is absolutely wrong. It is supplied by ulnar nerve is the right answer. Now, let us talk about adductor pollicis muscle. So, let me just enlarge this. You can see here this is the radius bone and this is the ulnar bone. Okay. So, here now I want you to show the two heads. So, actually here we can appreciate this is the transverse head, this is T for transverse head and this is O for oblique head of adductor pollicis muscle. So, here transverse head is originating from the shaft of the third metacarpal bone, and if we talk about oblique head, this is transverse head, oblique head is originating from the adjoining capitate bone base of the second and third metacarpal bone. So, capitate bone, second and third metacarpal bone, and they are inserting, where they are inserting? They are inserting into the proximal phalanx of the thumb. Proximal phalanx of the thumb, actually proximal phalanx of the thumb, to be more clear, it is inserting from the medial aspect. On which aspect? On medial aspect, which is quite clear in this diagram. Yes. So, all other points are absolutely correct. Yes, the major action of adductor pollicis is adduction, but it also causes accessory action. Opposition of thumb is also done in the process of adduction, has two heads of origin and supplied by ulnar nerve. So, B is the wrong option. Let us move on to the next, that is question number 7th. Radial bursa is a synovial sheath which is covering the tendon of which of the following muscle? Flexor digitorum superficialis, flexor digitorum profundus, flexor pollicis longus or flexor carpi radialis. Which is the right answer? Okay. So, mark the correct answer, my dear aspirants. Radial bursa is a synovial sheath covering the tendon of which of the following muscle? Covering the tendon of which of the following muscle? Chitranjan, FPL. Okay, FPL. So, FPL, flexor pollicis longus, is absolutely correct answer. Yes, radial bursa is a tendon covering. It's a bursa covering the tendon of flexor pollicis longus is absolutely correct, Chitranjan. Yes, you can see this diagram and you can appreciate the tendon of flexor pollicis longus is having a bursa covering it, which is called as radial bursa, and if we talk about ulnar bursa, it is covering the tendons of flexor digitorum superficialis, flexor digitorum profundus. It is forming a covering for flexor digitorum superficialis and flexor digitorum profundus. Got it? Okay. Tendons of flexor digitorum superficialis and profundus and covering the tendons of flexor pollicis longus. Absolutely correct. Okay. Now, let us talk about question number 7th. Which is the true statement in respect to trapezius? Which of the following is true statement in respect to trapezius? Which of the following is true statement in respect to trapezius? Your time starts now. 4 options are there. Innervated by dorsal scapular nerve, superior fibers retract the scapula, middle fibers elevate the scapula, inferior fibers retract, superior inferior fibers act together in rotating the scapula on the thoracic wall. So, yes everyone, according to you, which is the best right answer here? Which is a true in respect to trapezius? Which of the following is true in respect to trapezius? Innervated by dorsal scapular nerve, superior fibers retract, middle fibers elevates, inferior fibers retract. What is the right answer? So, according to you, which is the best possible answer? Please mark the correct answer. So the correct answer is E. Superior inferior fibers act together in rotating the scapula on thoracic wall. Okay. So my dear aspirants, let me give you the explanation. When we talk about trapezius muscle, it is getting innervation from spinal accessory nerve. So spinal accessory nerve is giving innervation to sternocleidomastoid muscle and also giving innervation to trapezius muscle. So these two muscles are getting innervation from spinal accessory nerve. Trapezius muscle is innervated by spinal root of accessory nerve, and it is having 3 fibers. It is having 3 fibers. So when we are talking about it is having 3 fibers. So when we are talking about its superior fibers are elevating the scapula. Superior fibers elevates the scapula. When we are talking about middle fibers, the middle fibers retract the scapula and the inferior fibers will depress the scapula. Now, one more important point is there which has been marked as the correct answer, that both the superior and inferior fibers of trapezius act together in rotating the scapula onto the thoracic wall. So clearly we have got E as the correct answer. Both superior and inferior fibers of trapezius, when act together, it is rotating the scapula onto the thoracic wall. So clearly E is the correct answer. All other options are not correct regarding trapezius muscle. I would also like to show you this superior fibers elevates the scapula. This middle fibers will retract the scapula and lower fibers will depress the scapula. This is the action of trapezius. Question number 8. Radial artery is located lateral to the tendon of which of the following structures? Radial artery is located lateral to the tendon of which of the following structure? Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, or flexor digitorum superficialis. Which is the correct answer? 5 options are there. Radial artery located lateral to the tendon of which of the following? 5 options are there. You can go for the correct answer. Your time starts now. Question number 8. Any idea? Anyone wants to write the answer? Actually, the correct answer, if we have to locate radial artery and we have to see its location is located lateral to which tendon, the correct answer here will be flexor carpi radialis. It is just lying lateral to flexor carpi radialis. So the correct answer, it is located lateral to the tendon of flexor carpi radialis. Okay, flexor carpi radialis is the right answer. So see here, radial artery, if we have to locate, radial artery lies just lateral to the tendon of FCR. It is located just lateral to the tendon of FCR, that is flexor carpi radialis. So in this diagram, I just want to enlarge this image. And let you show this relation. So here you can appreciate radial artery is located, this is the radial artery, and you can see here the tendon of flexor. So this is FCR tendon. So if you will see the tendon of FCR, it is just lying lateral to which structure? It is located lateral to that of the radial artery. So absolutely correct. Radial artery lies just lateral to the tendon of which of the following structure? Flexor carpi radialis. Done. Let's move on to the next. Which nerve supply no branches to the arm? So it is not giving any kind of branch in the arm region. Which of the following combination of the nerve? Whether the combination is of medial nerve, musculocutaneous nerve, radial and ulnar, or medial or ulnar, or medial or the radial, or musculocutaneous and radial. So accordingly, please mark the correct answer according to you, which is the best answer. Question number 9, your time starts now. Which nerve supply no branch to the arm? Which nerve supply no branch to the arm? Which nerve supplies no branch to the arm? Question number 9. Which nerve supply no branch to the arm? Question number 9th. Your time starts now. Please mark the correct answer. Chittaranjan. Okay, so my dear aspirant, the correct answer is median and ulnar nerve. So the correct combination of nerve is median and ulnar. So my dear aspirants, so here this combination is not correct because median nerve is not giving any branch in the arm, but musculocutaneous nerve is giving innervation to BBC, that is biceps brachii, brachialis and coracobrachialis. Also here ulnar nerve doesn't give, but radial nerve is giving innervation to triceps muscle. So it is also wrong. So that is the reason it will be also wrong, because here radial nerve is giving innervation to triceps muscle. Here median nerve, ulnar nerve, no branches are given in the arm region. They are supplying the muscles of forearm and also forming innervations into the muscles of forearm and hand. Median and ulnar is not right, because we know that radial nerve is giving innervation to triceps. Musculocutaneous and radial not the right answer. Musculocutaneous giving innervation to BBC and radial is giving innervation to tricep. So the correct answer will be C. Median and ulnar is the right answer, because these are providing no branches to the arm region. They are giving innervation to forearm muscles or hand muscles, and also giving sensory innervation to forearm and that of the lower down in the hands. Which does not take origin from lateral epicondyle? Which of the following structure is not taking origin from lateral epicondyle of humerus? Which of the following structure is not taking origin from lateral epicondyle of humerus? What do you mean by lateral epicondyle? Common extensor origin. Lateral epicondyle means common extensor origin. Common extensor origin. Common extensor origin, which does not take origin from lateral epicondyle of humerus. We have got following options. Mark the correct answer. Common extensor origin. The correct answer is abductor pollicis longus. C. Yes, Chittaranjan, you are right. Yes, Chittaranjan, you are right. Abductor pollicis longus. Abductor pollicis longus. Yes, absolutely correct, Chittaranjan. You have given absolutely correct answer. Yes. This is not taking origin from the any common extensor origin. Other than that, all these muscle, extensor carpi radialis brevis, extensor carpi ulnaris, supinator and extensor digiti minimi, all these structures are taking origin from lateral epicondyle, that is common extensor origin, but not the abductor pollicis longus. Abductor pollicis longus originates from, if we talk about abductor pollicis longus, it originates from posterior aspect of, posterior surface of radius and the ulna and also the intraosseous membrane. It also take origin from the intraosseous membrane. Abductor pollicis longus take origin from posterior aspect of the ulna, radius and that of intraosseous membrane. Okay. So also have a list of structures. So if we talk about the muscle which is taking origin from lateral epicondyle, which is the common extensor origin, lateral epicondyle is common extensor origin of the humerus. So the muscles taking origin from the lateral epicondyle is extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris and that of supinator muscle. So these are the muscle which is taking origin from the common extensor origin, but not the abductor pollicis longus. Abductor pollicis longus, just have a look on the origin and insertion of abductor pollicis longus muscle. So here you can appreciate abductor pollicis longus muscle originates from, it take origin from posterior surface of ulna and radius and also the adjoining part of intraosseous membrane. It is taking origin from posterior aspect of radius, ulna and also the intraosseous membrane. If I talk about insertion, dear, it inserts into the first metacarpal. It inserts into the first metacarpal and the action is abduction of the thumb of the hand. Origin from posterior aspect of radius, ulna and intraosseous membrane. Insertion, first metacarpal, action, abduction of the thumb of the hand. Extensor, abductor pollicis longus. Okay, abduction of the thumb. So done with this. So clear the Origin insertion of abductor pollicis. What is the nerve supply of abductor pollicis longus? Anyone? What is the nerve supply? Abductor pollicis longus is one of the muscle of extensor compartment. So, it is getting innervation from pin nerve. What is this? Deep branch of radial nerve. It is getting innervation from deep branch of radial nerve. Deep branch of radial nerve. Now, question number 11. Which of the following parts of humerus is matched correctly with the nerve with which it is in the direct contact? Which of the following parts of the humerus is matched correctly? So, this is match the following. Please mark the correct answer. Distal end of humerus is related to radial nerve. Surgical neck is related to musculocutaneous nerve. Radial groove is related to musculocutaneous nerve. Medial epicondyle related with the ulnar nerve, and scapular notch related with suprascapular nerve. So, 5 options are there. Please mark the correct one. Question number 11. This is match the following, and you have to see which structure is related to which nerve, which is the correct correlation. Which is the correct match the following. So, yes, I got an answer from MBBS and he is absolutely correct. Yes, medial epicondyle with ulnar nerve is absolutely the correct correlation. So, yes, medial epicondyle of the humerus bone is correctly related with the ulnar nerve. All other options are not correct. All other options are not correct. Okay. So, I would like to show you the diagrams where you can have the diagrams will help you to understand the correlation of important nerves and the bony aspects. Yes, Hina Khan, you are right. So, see here, when we are talking about surgical neck of humerus, it is clearly related with, surgical neck of humerus is related with axillary nerve. It is related with structure, it is related with axillary nerve. The radial nerve lies in radial groove. What is the correlation of radial nerve? Radial nerve is located in the radial groove and distal end of humerus is lying in direct contact with median nerve. Okay. Medial epicondyle is lying in direct with ulnar nerve, distal end of humerus is having correlation with median nerve. Radial nerve in the spiral groove, which is also called as radial groove, medial epicondyle related with the ulnar nerve. See the diagrams. So, yes, in this diagram you can clearly appreciate that this is the medial epicondyle of humerus, and just posterior to medial epicondyle of humerus, as you can see here, the nerve which is traversing here is the ulnar nerve. So, ulnar nerve is running just posterior to medial epicondyle of humerus. Medial epicondyle of humerus. Okay. Ulnar nerve is traversing just posterior to medial epicondyle of humerus. Now, axillary nerve, when we talk about axillary nerve, so let me just enlarge this image. So, when we are talking about axillary nerve, you can clearly appreciate that axillary nerve is having a relation to this neck of the humerus, and which neck is this? This is the surgical neck of humerus. So, it is winding around surgical neck of humerus. Surgical neck of humerus. Now, also I want you to show this image where you can appreciate the 3 nerves and in different parts of the humerus bone. So, here you can appreciate axillary nerve is winding around surgical neck of humerus. Just now the other diagram also we had seen, and the correlation of radial nerve is in the radial groove which is lying in the shaft. This is the correlation. So, actually this is in the shaft which is also called as spiral groove. Okay, here also you can see radial nerve is residing in the spiral groove, and just posterior to medial epicondyle you can also appreciate ulnar nerve is related just posterior to medial epicondyle. So, these 3 nerves are in correlation with the humerus bone at 3 different sites. Axillary nerve, surgical neck of the humerus, radial nerve, spiral groove, ulnar nerve behind the medial epicondyle. Yes, Hina, spiral groove and that of radial groove are same thing. Yes, they are same thing. Yes, they are same thing. One other, yes, they are same thing. One other option was given suprascapular nerve. So, have a look on suprascapular nerve. So, here you can appreciate the suprascapular nerve is winding around. It is going below the ligament. Which ligament is this? So here we have got suprascapular ligament is winding, it is going in the suprascapular notch and then it reaches through the spinoglenoid notch and it is giving innervation to two muscle, infraspinatus and supraspinatus muscle. So it is related onto the posterior aspect of the scapula, related with the suprascapular notch and spinoglenoid notch, as you can see. Spinoglenoid foramen or the suprascapular foramen, which is covered by the ligament, suprascapular ligament. Here this is related with the posterior aspect of scapula, giving innervation to two muscles above and below the, which is related with the which muscles are located above and below the spine of the scapula. So this is the spine of scapula. So this is supraspinatus muscle and below it is I for infraspinatus muscle. Got it? Got it? Now here you can see this is the region of cubital fossa. This is the region of cubital fossa, and on distal aspect, what I told you, distally on the humerus, this nerve which is running is median nerve. So here we have got median nerve. Okay, relation is MBBR. Okay, MBBR as we move from medial to lateral. So medial most structure is median nerve. Then the other structure which we are seeing here is the brachial artery. Then we have got biceps tendon, and the fourth structure is the radial nerve. Fourth structure is the radial nerve. Fourth structure is the radial nerve. So together how many structures are related? Four structures are related. So the first structure is the median nerve. Then we have got brachial artery and the biceps brachii tendon, and the fourth structure, lateral most structure, is the radial nerve. So done with this. Now let's move on to the next, that is question number 12. Which is true regarding rotator cuff injury? Which of the following is true statement regarding rotator cuff injury? Rotator cuff injury. Which of the following is true statement regarding rotator cuff injury? Injury or disease may damage rotator cuff, causing instability of acromioclavicular joint. Supraspinatus tendon is most commonly torn part in the rotator cuff. Teres major muscle take longest time to rehabilitate of rotator cuff muscle, and injury around the muscles pull away from the origin of acromion. Acute tear is common in young person. So which is most correct? According to you, which is the most correct statement? Which is the most common statement? If we have to choose one answer, we will choose which of the following as the most correct statement for question number 12. Your time starts now. You can mark the correct answer. So yes, Hina, it's A. Let me give you. No, we know that rotator cuff muscle is formed by SIDS. So we have got supraspinatus, infraspinatus, teres minor and subscapularis. So in that, if I have to take the correct answer, the most commonly part, the most common tendon which is getting ruptured here or torn in this condition will be, the correct answer is supraspinatus. So supraspinatus tendon is most commonly torn part of the rotator cuff. Okay. Chitranjan E, okay, no, the correct answer will be B. If I take the combination of four muscle which is forming rotator cuff, SITS. So acute tear is common in young is not correct. It is more common in older persons. So we will not go with, okay, it's okay. So we will not go with E as the correct answer. The correct answer is among all the muscles, that is supraspinatus, infraspinatus, teres minor and subscapularis. The one which is more commonly torn is supraspinatus tendon. Injury to the disease or damage, injury or disease may damage rotator cuff muscles and can also cause instability of glenohumeral joint. It can also cause instability of glenohumeral joint. Supraspinatus, if it is involved, initiation. Chitranjan, supraspinatus muscle is causing initiation of abduction, 0 to 15 degree. Supraspinatus is causing initiation. Chitranjan, initiation of abduction will be affected. Supraspinatus most commonly injured part, and acute tears are not uncommon in young person, it is more common in older. So these are all information about the rotator cuff muscles. So, acute tear is not common in case of young person, it is common in old, and it is not going to cause any instability actually of acromioclavicular joint. If it is involved, it is causing instability of glenohumeral joint or shoulder joint, not the acromioclavicular joint. Let us move on to the next. Question number 13. Which of the following is not intracapsular? Which of the following structure is not intracapsular? Coronoid fossa, radial fossa, olecranon fossa or lateral epicondyle. Which of the following structure is not intracapsular? Which of the following structure is not intracapsular? Coronoid fossa, radial fossa, olecranon fossa or lateral epicondyle. So, yes, lateral epicondyle is the answer given by MBBS and Priyansi, and both of you are absolutely right. Yes, both the epicondyle of the humerus, when we are talking about the epicondyle of humerus, that is the lateral and the medial epicondyle of the humerus, they are not covered by the fibrous capsule of the elbow joint. So, they are not intracapsular, they are lying outside the attachment of fibrous capsule of the elbow joint. Yes, Chitranjan, let us absolutely correct all of you. Let us show you the image for it. So, see here green color is the green line is showing you the attachment of fibrous capsule, and yes, absolutely correct. You can see both lateral epicondyle and medial epicondyle. These two structures are lying outside the attachment of this fibrous capsule, which is shown by the green color. Other than that, the structure which is lying intracapsular is the capitulum, the trochlea part, the fossas, the radial fossas. Yes, both, also olecranon fossa. So, all these process is also the coronoid process margin is attached, olecranon process margin. So, only epicondyle. So, both lateral and medial epicondyles of the humerus is lying outside the attachment of fibrous capsule. Aditya Avasti, yes dear. Let us move on to the next, that is question number 14. All pair about bony attachment around shoulder joint is correct except. All of the following about the attachment of the muscles of shoulder joint is correct except. So, have a look on all the option and give me the right answer. Question number 14. Question number 14. All pair about bony attachment around shoulder joint is correct except. All pair about bony attachment on shoulder joint is correct except. Question number 14, yes, please try your luck, please mark the correct answer. So, the combination is latissimus, okay, I got an answer, subscapularis on C, Priyansi is telling C, what about others? So, my dear aspirants, the correct answer is, should I go with the correct, D is the correct answer, teres major. Yes, MBBS has given the right answer. Teres major, yes, absolutely correct. Teres major is the muscle which is not attached on greater tubercle. Actually, this is inserting on which structure? Teres major, it is inserting into the medial margin of medial lip or median margin of bicipital groove or the intertubercular sulcus. Okay. Other than that, latissimus dorsi in the floor is correct. Short head is a rising tip of coracoid process is correct. Subscapularis lesser tubercle and radial styloid process insertion of brachoradialis is absolutely correct. So, only D option is not correct, and I would like to show you various images so that you can understand this attachments. So, now the first thing is about teres major muscle, which was wrong. So, here you can appreciate this is the teres major muscle, and exactly teres major is one of the major and the other major is pectoralis major. So, these two majors are attached onto the medial and lateral lip. So, here this is the medial lip and this is the lateral lip. So, this is the medial and this is the lateral lip. So, what you can appreciate, this is the lateral lip of intertubercular sulcus, and this is attaching onto the medial lip of intertubercular sulcus and in the floor of intertubercular sulcus. If I talk about the intertubercular sulcus floor, if I talk about intertubercular sulcus floor, the attachment is of which muscle? Latissimus dorsi muscle. So, done. Now, other than that, you can also appreciate coracobrachialis muscle and short head of biceps brachii. These two structures commonly originates from this bony process. What is that bony process? This bony process is coracoid process of scapula. Coracoid process of scapula. So, that is also correct. This was one of the option that is also correct. Other than that, yes. Now, let us see this image. So, here you can appreciate, okay, you can appreciate this is the supraspinatus muscle tendon, okay. So, let me show you this figure, okay. Firstly, you can concentrate here. So, here you can see this is supraspinatus tendon, this is infraspinatus and this is teres minor. So, can you appreciate these three? So, please just have a look. Supraspinatus. So, here supraspinatus tendon, infraspinatus and that of teres minor, SIT. What is it? SIT, sits. So, sit, only SIT, sit. This together is inserting onto GT. What is GT? GT means greater tubercle of humerus. So, among this is greater tubercle of humerus. So, actually these are three muscles of rotator cuff group in which these three together supraspinatus, infraspinatus and teres minor together inserts onto the greater tubercle. If you will see this image, here you can appreciate the subscapularis muscle inserts on LT. What is LT? LT is lesser tubercle of humerus. It inserts into lesser tubercle of humerus. So, this is all about the insertion point of the rotator cuff muscle. So, it is quite clear from this image and this is also correct. So, absolutely the wrong statement, after seeing those images, it is quite clear that the wrong statement was teres major inserting or attached to the greater tubercle. It is attached to medial lip of bicipital groove. All other options are perfectly correct. Yes, okay, yes, and brachioradialis is also correct. It is exactly inserted just proximal to the radial stelloid process. So, exactly just proximal to radial stelloid process there is attachment of brachioradialis. Let us move on to the next, that is question number 15. Abduction of hand is caused by which of the following muscle? Abduction of hand is caused by flexor carpi radialis, flexor carpi unlaris, flexor digitorum profundus, flexor digitorum superficialis. Abduction of hand. So, please mark the correct answer. Your time starts. According to you, which is the correct answer? Abduction of hand is caused by. Abduction of hand is caused by which of the following? Abduction of hand is caused by which of the following? A. So, flexor carpi radialis is absolutely correct answer. Yes, flexor carpi radialis is absolutely correct. Actually, flexor carpi radialis is not only causing flexion of hand, along with it, it also causes abduction of hand. Actually, flexor carpi radialis acts along with extensor carpi radialis longus and extensor carpi radialis brevis and causes abduction of hand. So, this is also the action done by the flexor carpi radialis muscle. And my dear aspirants, before the ending of the session, I would like to give you certain information for NEET PG subscription on the iconic and that of light. So, these are the comparison of the subscription of Unacademy, NEET PG subscription, iconic or light, whichever subscription you want to join. You can take the subscription, you can use my code NAT10 and get an additional discount of 10%. So, you will get an additional discount of 10% if you are going to take this subscriptions. This will be highly beneficial. Okay, dear. So, my dear aspirants, if you are a student of first and second year, you can go for the ma'am, you daily live on most of the time, Hina Khan, most of the time I take live sessions. Tomorrow also exactly like today's timing I will take. Tomorrow also exactly on today's timing I will take session, so you can join me live. Okay, tomorrow also there will be upper limb session 4, so you can join me live. Also on Wednesday I will take another session on special class also, so you can join on the Unacademy free platform also. If you want to join my free sessions on Unacademy, you can use my code NAT10. Okay dear. So yes, my dear aspirants, and it's also important that before ending I would like to tell you, do like, subscribe and share the Let's Crack NEET PG platform. All the best. We will exactly meet tomorrow at 5:15 p.m. with the upcoming session of the more of upper limb MCQs we will target together. Okay, if you are attending a session on Unacademy special class which I will take in the evening session, on the Unacademy special free platform, you can also download the PDF notes. So this will be actually highly beneficial for you, Hina. So all of those who are watching the session on the YouTube, yes, most of the session will be completed here, but if we are going to continue the session also on the special free platform, so you should be present there. Why? Because you can also download the PDF notes. Okay, after completion of the session you will get the PDF notes. Also I would like to tell the students who are watching the session for the first time, they can use my code NAT10. So for watching free sessions on the Unacademy platform, you can again use my code NAT10 for enrolling and getting the benefits of free sessions on the Unacademy platform. For this you have to download the Unacademy app, you have to find your goal as NEET PG, then either on all the groups of Unacademy Telegram group, that is the Telegram group of Let's Crack NEET PG Unacademy Telegram group. Daily I share my all links of the session, so you can use this code and be present free for the session, and you can download the PDF notes. Also, if you have downloaded, you can just type my name, Dr. Monalisa. Upcoming sessions you will get information and you can be present live. So all these are very useful for you. All the best and keep studying. Thank you so much. We will again meet tomorrow exactly on this channel. Let's Crack NEET PG. 5:15 will be the timing. Continuation of upper limb second part, fourth part. Okay, thank you. Thank you dear aspirants. Thank you.